I said, y'all, it's about to go down.
This is the Polish Ambassador, featuring the Grouch and Scott Mace. Don't get it twisted.
I might be conscious, still I like to fuck.
I like it.
Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect.
Word.
Indulge in deep combo, get hyped when she twerk.
What's going on? What's going on? This your boy Steve Belcher, the Urban Health Nurse Educator. What's going on tonight? How's everyone doing? Hey, look, this is going to be a good education session. So share this video if you can. Whoever's in here, just go out, share it, and come back. Because if you're a kidney warrior or you have a family member that's a kidney patient, and you wanted to know just the facts on anemia without all the technical mumbo jumbo to confuse you, then you need to be on this broadcast right now. Share this video. I mean, let me tell you, you had James Fabian, Dad Vice TV on earlier with some kidney disease education, and here I am at 9:30 p.m. at night talking about anemia, just the facts. Where else are you going to get kidney disease information that will help impact your life in face of this disease? You can Google, try to go on Facebook, on YouTube, and see if you can get a live broadcast of someone talking about anemia, let alone a nurse. I mean, most nurses probably tired, they sleep, they doing what they doing. But you got one nurse right here that cares and that's up right now, ready to educate if you're ready to listen. All you got to do is hit that share button so other kidney warriors and family members who just got diagnosed, because we know people are being diagnosed each day with kidney disease. It may not be kidney failure, but kidney disease have the 5 stages. And then when you get close to the end stage, you might, but the chances are you will develop anemia. How many warriors watching this broadcast that has kidney disease, not kidney failure, that goes to the nephrologist's office and get Procrit shots or Epogen shots to raise their hematocrit or their hemoglobin? Yes. So let's get into it. What is anemia? People say, I got anemia, I'm anemic. We all know it's low blood count basically, but let me just break it down like this. Every part of your body needs oxygen. Every part, it needs oxygen. So red blood cells carry the oxygen through the body. The oxygen goes via the red blood cells. The red blood cells like a taxi cab and the oxygen sitting in the back chilling, right? And it's going all throughout the body, down in your legs, feet, hands, your brain, your heart, everywhere. So people with too few red blood cells have anemia, right? And you can lose blood cells a lot of ways. So you may be saying, Steve, what causes anemia? How would I know I have it? So people on dialysis often have anemia. Remember that. because they lack, once the kidney shut down, right? They lack or they stop producing a hormone called erythropoietin, or EPO for short. All right. Now, EPO or erythropoietin is made by healthy kidneys. If you got healthy kidneys, you are producing erythropoietin or EPO. And what that does, what that hormone does, which a lot of people don't think about, because let me say, how many people walking around every day like, damn, what is my blood count? Is my kidneys producing erythropoietin so it can stimulate the bone marrow? You're not thinking about that. You're thinking about everyday life. Everyday life. So what happens, EPO is made by healthy kidneys. What EPO does, or erythropoietin, it tells the bone marrow to make more red blood cells. Keep on producing. We need you to keep on producing. But when your kidneys fail, they no longer produce EPO or erythropoietin. It shuts down. And without enough EPO, there are fewer blood cells to carry oxygen in the body. So, your kidneys fail, they stop producing erythropoietin. The bone marrow doesn't get that hormone to signal it to keep producing more red blood cells. So that production stops. Like an assembly line in Detroit is shut down. Right? I hate to use that analogy because people lost their job, but it just shut down. It stopped producing. And then that's why we have to give you this. It's called EPO. And we're going to get into that in a minute. That's made synthetically. So, other causes of anemia include iron loss due to blood loss. Some blood is lost when needles are placed and removed and in dialysis tubing. You ever see me? So this is very important. This is a teachable moment right now. If you're in dialysis and your dialyzer, the artificial kidney, is constantly clotting, and you're finding them throwing away the system, and you still got blood in the tubings, in the dialyzer, that's major blood loss. You may be sitting there watching TV, right, with your headphones on, right? You may be in the chair. I've seen it. You may be in the chair with your headphones on, pushing the button, right? On the TV, watching Price is Right or Wheel of Fortune, and the machine is going off, right? And you see your tech there, and you like, oh, they taking care of it. And you steady watching TV, like thinking they taking care of it. The next thing you know, you look, right? Because you like, I wonder what's happening. You look to the right, and it's a new setup. It's a new setup. New lines, new dialyzers. No one never rinsed your blood back. they disconnect. You look down and there's blood in the needle cannula, and it's a new setup. And you're not putting two to two together. You just thinking, oh well, they had to set up another whatever, but they just threw away almost a pint of freaking blood that can cause you to have anemia. And I get so angry and passionate about this because this is where the teaching comes in, where you have to pay attention every single moment of what's going on in your treatment. There's no gray areas in dialysis. There's no gray areas. So if your alarm is going off and you got your headphones, you watching TV, and you see the technician there more than 5 or 10 minutes fumbling with those lines, you need to take these damn headphones off and ask them what is going on. So then you would know, you could be informed of what's going on. Because when they throw away that blood, we talking about other causes. Anemia include iron loss due to blood loss. Some blood is lost when needles are placed and removed. And in dialysis tubing, that tubing went straight in the trash and you didn't even know it. Didn't even know it because you're watching Price is Right. Nothing is wrong with that, but you also got to be focused on your treatment. You can't leave the saying, because it's true, to err is human. No, not in dialysis. There's no room for error. Some blood loss occurs in surgery. So when you go to surgery and you get the access put in, or any other surgical procedures as a dialysis patient, when you go into the hospital, you also got to remember the blood loss through that surgery and got to keep a track of what your blood count numbers are. A lot of patients come out the hospital saying they feel weak, they tired. Yes. And then you get blood loss through GI problems. How many warriors know about those GUAC cards where we ask you your anemia, your hematocrit, hemoglobin is low, and the doctor wants you to take those stool cards home, and the stool cards had a damn wooden stick, and we ask you to get a sample of your stool and smear it on the card. So you bring it back in and we put that liquid on there to see if you got a positive blood occult, GI bleeding. Yes. So you have to pay attention to this. Blood is also taken for lab tests, monthly labs. When they be drawing all those blood labs, annual labs, quarterly labs. Every time you turn around, they drawing labs for calcium and phosphorus or hemoglobin, hematocrit. Sometimes they may waste it. They may draw labs and may not even need to. They don't tell you. They throw the tubes away. Oh, well, this happens in dialysis. Why is anemia important to you? Anemia can reduce, hear me out now, anemia can reduce your quality of life and increase your risk of death. Share this video. Let me put the banner up. Come on, man. I mean, if we got any, start a watch party, let other warriors know. If we got any warriors from across the water, God bless you. Thank you for watching. Let's come together as a kidney community. Share this information because you're not going to get it anywhere else on a Saturday night from a registered nurse at 9:30 at night. You're not just going to get it. I promise you, and I'm not saying that to brag or boast, but I'm just being honest. And how many warriors would love to have access to a dialysis nurse because you could be going through something right now and you don't have no number to call, no one to reach out to answer those pressing questions that you may have. Well, that's why I'm here. You can reach out to me in Messenger. Many warriors reached out to me and asked me questions. There's no other dialysis nurse unless you know someone privately that's going to answer your questions late at night. I guarantee you that. So again, welcome to our warriors that's global. Again, share this broadcast. Let's not keep this away from anyone else who wants to know or who don't know about anemia and how important it is to stay alive. I mean, did you just hear what I just read? Anemia can reduce your quality of life and increase your risk of death. With anemia, you feel tired and have less energy to do things you enjoy. You're not supposed to feel that way. Less oxygen reaches your brain. Hello, we talk about the brain fog. So you may not think as clearly. How many warriors talk about the brain fog? Have you looked at your hematocrit and hemoglobin to see how much oxygen is flowing through your blood? You got to connect the dots. Connect the dots. I'm serious. Less oxygen reaches your brain, so you may not think as clearly. You may be less able to fight off infections. People with anemia are also more likely to have heart problems. Did anybody tell you that? Have you been told that as a kidney warrior when you started dialysis or when you went to go see your nephrologist? Did they tell you people with anemia are also more likely to have heart problems? Did they tell you men with anemia may be less able to have erections? Yeah, let's put it out there. Listen, guys, there's nothing to be ashamed about. This is a medical condition. And there's ways to resolve that medical condition. So don't be ashamed or shy to talk about this. All right? Again, people with anemia are also more likely to have heart problems. Men with anemia may be less able to have erections. Women may have changes in their menstrual cycle. Women, how many of you had changes in your menstrual cycle with kidney failure? Have you looked at your hematocrit, your hemoglobin? Women, how many nurses, how many of the charge nurses told you if you're still having your menstrual cycle, let them know so they could cut your heparin so you don't bleed out? Do they give you that information? Or do you let your nurse know, women, when you have your menstrual cycle so they can cut your heparin, your blood thinner, if you get it? If you ever wondered and you never told a nurse that you were on your menstrual cycle and you was heavy bleeding, did you ever look at the connection between the blood thinner you get on dialysis? Children with anemia may not grow as well. So how is anemia treated? And that's where I go back to my picture. How is this treated, anemia? Now, without getting too technical and getting to all the parameters of Epogen, I want to keep it simple. 2 medications treat anemia. Now, there may be more. I'm reading from a 1999 article. So, Fresenius has Mircera, you got Procrit, and you got an Epogen. So, Epogen is man-made, and it comes in a little bottle like this. This is a 4,000 unit dosage, all right, in a 1 milliliter bottle. So if there's ways to determine how much dosage you get. So you got bottles that come in 2,000, 3,000, 4,000, and 10,000, right? So if your physician say, I want you to get 4,400 units of EPO, you would get this bottle right here, because they always put what's called an overfill in the bottle. That's a little bit more than 1 milliliter. So this is a synthetic man-made called Epogen, Epoetin alpha, that's made by Amogen. It helps the body make red blood cells. So instead of your kidneys producing a hormone, we as nurses come around and give you the EPO in the lines. How many warriors, when the nurses come around, they say, I'm about to give you your EPO shot? Well, that if they don't, that's what I do or did. I let you know the medications that you were receiving. So this helps the body make red blood cells. Now, iron supplements provide the building blocks for red blood cells. Your iron level must be adequate for Epogen to work. All right. So when they measuring this, they're also looking at your iron stores. How many people get the iron, the Infed, the Felicit, the Vinifer? Yes. So how that works with the iron, right? Let me tell you how they do that so you can understand how they break down the dosage. So the doctor, he may order 1,000 milligrams of iron, right? There's no way we can give you 1,000 milligrams of iron in one setting. It's impossible. You get iron overload, right? So what happens, I thought I had a syringe. But what happens on the, do I got any pictures? Wait a minute. I may not, nope. So what happens, like the 10 cc syringes, or you see the bags, the nurses hang up the little 50 milliliter bags. But normally we give them in the 10 cc syringe. You get a course of iron. So it's, instead of the 1,000 milligrams all at once, we break it up into 10 dosage, right? The Vinifer is 100 milligrams per, I want to say 5 liter, wait a minute, per 10 milliliters. You got, I think they have the 50, but the Vinifer comes 100. You draw that up, you give it Monday, come back on Wednesday, get another 100. You see what I'm saying? That's 200. Come on Friday, 300, right? Up to 10 doses till it equals 1,000. That's the end of your iron course. Then he may say, we want to put you on a maintenance dose, give you 50 milligrams every other Wednesday or every week. So you may see him come around with the little syringe with the dark liquid in there. Some patients say it tastes like licorice, and we're putting a little bit in the lines, just a little at a time. Don't let them slam that in there because they're not supposed to slam it. You get sick. You just put a little squirt at a time over like 3 to 5 minutes. That's how you're supposed to administer iron, right? Put a little bit in. We come back, put a little bit more in, come back, put a little bit more in. So how is anemia measured? So how this is measured, remember I was telling you about drawing labs? So a lot of units, especially the Vita and Fresenius, they do bi-weekly blood draws, hematocrit, hemoglobin, and they may draw calcium phosphorus, right? Those are two things that they want to draw. And if you're on a special bath, like a calcium bath or a potassium bath, they may draw weekly potassium level to monitor your potassium. But I guarantee you, a lot of times it's bi-weekly hematocrits, the little purple tube. So a blood test called hemoglobin. It measures the oxygen carrying protein in the red blood cells. Let me repeat that. A blood test called hemoglobin, which measure anemia, measures the oxygen carrying protein in the red blood cells. A blood test called hematocrit measures the percent, not the oxygen carrying protein, but the percent of red blood cells in the blood. Now, we all heard of the National Kidney Foundation. They got this thing called DOKI or KDOKI, right? It's a trademark. Basically, it's like a benchmark or a standard measure. It recommends that your target hemoglobin level should be between 11 to 12. So kidney patients' hemoglobin should be 11 to 12. Now, in dialysis clinics, let me tell you how slick they are and how they save on the money. Just a quick lesson. When your hematocrit, right, reaches between 11 and 12, you remember how you was getting the Epogen? You remember that? Well, when your number gets to 11 to 12, or it goes over, they cut the medication. They stop it. They completely stop the medication and then wait for your numbers to seesaw back down, right? And once it seesaws back down, the nurse, if they have one, if they have a clinical manager to monitor the hemoglobin, because remember this show that I talked about blackball and people leaving the company because they're not happy or they fire people? Well, in the Vita, they have a FA that has a BA or a master's degree. It's not a nurse, but a business person, the facility administrator. And then you have the clinical manager, the CC. Now, the CC does the clinical stuff for the FA because the FA don't know squat. They don't know numbers from a can of paint. Yeah, I said it. If that clinical coordinator is gone, say she got pregnant, Say she's sick with COVID. Say she's pregnant. Say whatever. She got married, went on, she left. Who the hell is going to adjust those numbers on those patients so those EPO doses can get adjusted and you can monitor and see what patients may be losing blood? Maybe a patient hematocrit dropped from 12 to 8. How did that happen? Evidently, it's some blood loss somewhere. If your hemoglobin drops from 11 to 6 or from 12 to 8, are you bleeding out in your stools? Where did that big drop come from? But if you don't have a clinical coordinator to monitor that, you ain't got squat. Because ain't no freaking FA with no bachelor's degree or master's in healthcare management going to know jack shit, excuse my language, ain't going to know jack about managing hematocrits and hemoglobins. A nurse does that, like myself. So that's why we say you got to take hold of your education. Because if the clinical coordinator is not there, and the FA is not a nurse and a business person, and they got to get somebody from another unit to come over and cover another clinical manager or CC, shit, she got to cover her patients too. What they going to do? She going to come over and work in this unit, then somebody else going to come over and work her unit, and then somebody else going to come in that other person's unit? What, freaking leapfrog? Are you kidding me? So that's where your care suffers. That's what we're talking about, where your care suffers at the end of the day. Because if there's nobody there to adjust those numbers and make sure this, I seen it. I seen patients fall through the crack. It ain't no secret. So I'm telling you, you go to DaVita, you go to Fresenius, you go to US Reno, Universal Dialysis, whatever dialysis unit you go to on this planet, I don't give a damn who you trust in that unit, who you like, what doctor you think is nice, what technician you think is nice, what nurse you think is nice. You better take control of your health, because at the end of the day, they could give a damn once they leave those doors. Do you think anybody's going to come on a broadcast and share information like this once they go home after working 10, 12, 13 hours, taking people off of dialysis and dealing with different personalities? You've seen it in the clinics. You see patients getting frustrated, patients getting stuck, yelling. You can hear them all across the other side of the room. You can hear patients cramping. You can hear people with loud outbursts. This is real, guys. And as much as you may love and like your technician because they treat you right and put that on, when they punch that clock, they're going home and they don't give a damn if you in the emergency room at 12 o'clock at night. You know, ain't nobody to give you their phone number because you may have a question, because you don't know whether you should go to the emergency room or not because of a small problem. You go to the emergency room, you wait there 6, 7, 8 hours only for them to send you back home because you could have remedied that problem at home instead of sitting there 10 to 12 hours waiting for a nurse to tell you something that if you had somebody's number, they could have told you the same thing. So the Epogen package, the insert in the package recommends a target hemoglobin of 10 to 12. So how can you, if you're on dialysis, how can you avoid anemia? Let's talk about that. Let's talk about that right after this.
This is the Polish Ambassador, featuring the Grouch and Scott Mace. Don't get it twisted.
I might be conscious, still I like to fuck.
I like it.
Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect.
Word.
Indulge in deep combo, get hyped when she...
All right, guys, what's going on? Now, as I was saying, how can you avoid anemia? If you're dealing with kidney disease, kidney failure, how can you avoid anemia? Has anyone told you at your unit, any of the technicians that you love, the nurses, some may, some not, but have any of them told you in the last 30 days how you can avoid anemia? I mean, it's the regular routine, I'm sure. You go in, you get hooked up, you say hello, they discontinue dialysis, you get weighed, and you go home. But did someone say, hey, Aaron, hey, so-and-so, do you know how you can avoid anemia? Has anyone said that? So how can you avoid it? Let's say the problem, you feel tired. How can you prevent it? Discuss your target hemoglobin hematocrit with your doctor. They say treatment team. I say with your nephrologist. When that boy come around and he, looking, talk to him about your hemoglobin and hematocrit. What is my target? Ask him, what is your target? Don't let that sucker get past. Ask him, what is my target hemoglobin hematocrit when you go in on Monday? Ask him, are you getting enough iron? Also, discuss your symptoms with your doctor to see if there is another cause for your fatigue, if you feel tired. Check your stools. If they are tar, like black, tarry, you may be bleeding in your GI system. Okay? Make sure when they pull the needles, you don't have a lot of blood spill. Make sure when they draw labs, ask them what they're drawing those labs for and how many tubes they need. Make sure when the machine goes off that they reset that machine fast, because when that machine goes off, the blood pump stops. The blood pump stops, your blood stops moving through the circuit. And if you're not getting heparin, you're at risk for your system to clot. So you want to reset that machine as soon as possible. When you see that alarm go off, especially if it's a red alarm and if it's constantly ringing, alarming, 9 times out of 10, your blood pump stopped. That means your treatment stopped. Make sure you're aware of that, and make sure if your machine is not turned towards you so you can reset that machine, make sure you call a technician over there as soon as possible if no one is responding. Because we know most people are sitting on their phones or at the nurse's station in a huddle talking among themselves, and when the machine goes off, they wait for someone else to go reset the alarm. So I'm just trying to save your life, save you from preventing your blood to get clotted, y'all. Be sure to get as much iron as your body needs. As I was saying, what should you ask the doctor? Am I getting enough iron? What foods have iron? What can I do if my hemoglobin or hematocrit is at target level and I'm still tired? What if your hemoglobin hematocrit is up, but you still feel tired? You need to investigate that as well. Do you need IV intravenous iron? Let's say you have this problem. My hemoglobin goes up and down like a roller coaster. How many warriors follow their blood count and see their hemoglobin 1 minute is 12, the next minute is 9, 1 minute is 8, then it's 10. That's a roller coaster. Ask your doctor how your dose of Epogen and iron affects your anemia. Ask them that. Don't be shy. Also, with the approval of your doctor, exercise to build stamina and raise hemoglobin hematocrit levels. What should you be asking? Can my Epogen dose be changed or given more often to make my hemoglobin more stable? Do I need to receive Epogen by injection, which meaning sub-Q in your fatty tissue, in your stomach, or under your muscle hair, right? Rather than giving it to you in the tube and while you're on dialysis. Because what if somebody give you Epogen and your machine clots right after that? We don't know if you got the Epogen. See, it's a lot of stuff, guys, that you got to be aware of and watch the technicians and nurses that work with you. And I'm not taking nothing away from these guys, but I'm just telling you to hold them accountable and to be more vigilant and aware of what people are doing with your treatment. Because, again, there's no gray areas in dialysis. Also, ask them how much should your hemoglobin hematocrit change each month. You shouldn't be going up and down like that. Also, ask them what kind of exercise can you do safely. So, with that being said, you can eat enough protein that can help provide the fuel to make red blood cells. Chicken, fish, beef if you're a meat eater, fresh pork, tofu, eggs, turkey or high in protein. I talked about that. So that's it on that. Let me see something. Let me just share this with you that you should know as kidney warriors, and then I'm going to call it a night. Do you know how to recognize an infection? And if you don't, if you have a catheter or even in your arm, your access, report to the nurse or your technician if you are experiencing any of the following signs: a fever. All right, then the access site is swollen or bulging. The access site is red, warm, or has pus, and severe pain at the access site. Remember, infections of the vascular access site can be life-threatening. I'm telling you, you get a bloodstream infection through your access, man, that can wipe you out. Also, just know that when a new patient starts dialysis, on an annual basis, they should have reviewed personal hygiene and hand hygiene techniques, patient responsibility for proper care of the access and recognition of signs of infection, recommended vaccinations, including hepatitis B, influenza, and pneumococcal, and reasons for selecting a fistula or graft over a catheter to lower the risk of infections. Patients should have education in that annually and when they start dialysis. Also, just to let you know about dialysis infections, which is a cause for concern, in the U.S., there are about 400,000 to 500,000 people relying on hemodialysis. Approximately about 100,000 receive hemodialysis through a central line or catheter. Now, central lines have a higher risk of infection than the fistula or graft. Remember that. And also, CDC recommends, or CDC estimate, 37,000 central line associated bloodstream infections may have occurred in U.S. hemodialysis patients back 12 years ago in 2008. Just imagine how many dialysis patients now, and you just multiply that tenfold. So let me read these comments, and I'm going to call it a night. Thank you, Pat, for watching. I appreciate you. Thanks, Katisha. Love you. Thanks for watching. Thank you, Miss Regina. Appreciate you. She had it. Miss Pat, she had plenty of shots. Ashley Thomas, a nurse I work with who's now one of my best friends, is now Central Anemia Management. Oh, that's awesome. That's awesome, Ashley. Thank you for weighing in. I won't draw labs until I double check, specifically when I know we just drew them. And I get so mad when labs are left. Yep, I know. And how about the lab that's left in the bags, you know, the tubes that and patients in the hospital, and they may leave them in the bin or a bucket, and they pile up, and they end up getting mixed up, and you draw them, and they got the wrong damn labels on it or barcodes. I'm sure you know what I'm talking about. I call it kidney brain. Yeah. Nope, Martha. Marchita. She says no. I'm not sure what you said no on, but thank you for commenting. Hello there as well. Hey, Dad. Hey, James. Doctors often describe anemia as fatigue, when in reality, it is your organs suffocating since they are not getting. Yep, you hit it right on the nose, man. Right on the nose. And guys, tune in. I mean, you got so many shows going on now. I don't know what days to tell them to tune in. But go to his page on Facebook. Some awesome shows from live experience. They even had the iron drip too fast, and that can make you sick. Yup, absolutely. I seen a nurse do it. I seen it happen. Absolutely. Absolutely, Pat. I'm sorry that happened to you. You know, I normally give it in a drip in saline, slow drip, or if I'm giving it in a 10 cc, especially if I have a lot of people getting it, like this is what DaVita would do. We could have a 30 chair unit, right? And they may make one nurse or two nurses, could be even one, right? One nurse have 3 patients and give meds from one side, and the other nurse may have 13, 14 patients. If you got like 7, 8, 9 patients getting iron, that's a lot of medication. On top of that, if you're getting vitamin D, like Zemplar or Hectorol, and EPO, and they make you draw them up in separate syringes. So if you get like 12 mics of Zemplar, and you got the 10 mic in the 2 milliliter bottle, right? You still got to draw up that 10, and then you got to, I'm sorry, in the 1 milliliter bottle, you draw up the 10, and then you still got to draw up another syringe to get the rest. The point I'm trying to make is you have all these multiple syringes, right? Because that's how they want you to draw it up. And you give, and you see it, the nurses coming to the chair, about 5, 6, 7 syringes in their hand with your labels on it, and they set it down right on the ledge of the chair, and you looking at it like damn, what is this? What am I getting? How many been through that? So this is what I'm saying. You gotta know what's going on, your dosage. But I got off track here. I was saying that to say to Pat, when you're giving all those medications, I give it in the syringe, because if I'm hanging up 6, 7 bags of iron, and you ask the technician that's supposed to be watching the patients, look, watch my bag for me. And they go out on the phone somewhere else, don't tell you jack shit, excuse my language. Next thing you know, you got freaking air in your lines because the bag went dry, because you asked the technician to watch it. They didn't watch it. I mean, at the end of the day, I'm the one to blame. But if I'm hanging 9 bags of iron with no help, and I'm getting other medication, how can I do it? I'm only one person. And then the company get after you because they say you're moving slow. Yes, that's what we go through as nurses. Well, at least that's what I went through. And I dare nurse to come on here and say they never been overworked at a DaVita. And if they have, it must be the one out in Beverly Hills or somewhere where the patient ratio is maybe 2 to 1 or whatever the case may be, and they don't, they're not moving like that. But every unit I worked in the city, urban community, is always quick turnaround, like assembly line. Get them in, get them out, get them in, get them out. And you know why that's the case? Ask me in the chair, right? Why do we call you when your time is at 3 o'clock and you doing something or you got something to do before you go into dialysis, and you get this call? Hello? You don't got call ID, so you can't see who it is, right? So you don't answer it. You pick up the phone. Hello? Hey, Mr. Johnson. This Steve from DaVita. How you doing this morning? Oh, I'm doing all right. Hey, we got a chair available. Do you think you could come in? Well, I had something to do. When you need me to come in? Well, can you come in about 45 minutes? And you don't know, you just started dialysis, whatever. Yeah, I can. You hang up the phone, damn. Shit, I had something to do. I wanted to go do this. And we at the unit, yeah, I'm hanging up the phone. He coming in, set up for so-and-so. We got him to come in. Thank you. Greetings. Thank you, Leslie. Thank you. God bless you. God bless you from Mexico. Peace and blessings from Washington, D.C. Sending you positive vibrations and positive thought and energy. But you hang up the phone. Now you got to get ready and alter your plans for dialysis. We at the unit jumping for joy because we got you to come in. What that does, it fills that chair. Every time that machine runs, the company makes money. Period. Fill the chairs. Fill the chairs. Call the patients. Find out where they at. Make sure, reschedule the treatment. Somebody can't come in this day because you got to go to a funeral. They call you. We got to rearrange your treatment because you got to get your 3 days a week. I know you need treatment, but I know people who miss dialysis 3 weeks, 2 weeks, 3 days, 4 days. Do I recommend you doing it? No. But everybody's body is different. Okay, you missed 2 days 1 week. So what? They want you to make it up so they can get paid. There's no ifs, ands, or buts about it. If you got something to do, if you've been going to treatment all along, you got something to do, and you miss one treatment, and you go in Friday, you come Monday, Wednesday, Friday, you do your treatment, and you miss. Yes, they probably want you to make it, especially if you one that abuse fluid, if you don't manage your fluid. Yes. But if you manage and you're doing everything right, you miss one time, that's no sweat off your back. I mean, again, if you're doing everything correctly, I don't recommend you doing this. But what the point I'm trying to make is every time those machines run, the company gets paid. That's the bottom line. So why not do it at home in the comforts of your own home? They still get paid, but you're still in the comforts of your own home. And when they call you, you go in, sometimes you may have to wait because they may be changing over, taking people off. And that's when it starts getting dangerous. Because they got the chair available, they got to take somebody off, you come in, they may have you sit down, they may be putting you on and taking somebody off at the same time. I've seen it happen. I know it happens. And if it happens to you, make sure you tell that technician, don't ever do that again. How is somebody going to focus and do a complex procedure that can kill you, put you on, and take somebody off at the same time, especially if your machines are next to each other? They got to take off their gloves, wash their hands, go back and forth. So, again, watch who's taking care of you. Be mindful of your treatment. And keep coming back. Keep coming back. share this broadcast for more information. I'm going to give it to you straight. You may like it, you may not. But I want to tell you, like if I was talking to one of my family members and they need to know the truth so they can make an informed decision based on facts and scientific data, right? That's what you want. Evidence-based information, not hearsay. So, with that being said, my friends, I thank you for watching. I thank our guests from Mexico. Thank you and God bless. Please share this broadcast, share our page, Urban Health Outreach Media, with your friends in Mexico, your family, and let them know we're here at Urban Health Outreach Media to give you quality information to help you live a quality, sound life in spite of kidney disease. God bless you guys. Good night. Stay blessed and encouraged. Peace.
Yo, it's about to go down. I said, yo, it's about to go down.
This is the Polish Ambassador, featuring the Grouch and Scott Mace. Don't get it twisted.
I might be conscious, still I like to fuck.
I like it.
Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect. Indulge in deep combo, get hyped when she twerk.